Ontario is doing well in a number of areas. If you look at the numbers of seniors being served in our home care program through our CCACs and our community support sector, as well as the supply of long-term care beds we have in Ontario, we do better than many provinces in terms of reaching out and serving seniors in need. So that's an area Ontario can be proud of. Ontario and Manitoba probably are at the high end of the numbers of seniors that they're serving. We also have improved the capacity of a number, very recently, of our community care sector in two ways. The first way is that the Minister of Health in Ontario has made a number of important announcements about the community care access centers, which are our home care program in Ontario. And they have expanded the basket of services that can be authorized. They have changed the levels of care that people in high levels of care need, and in general started to move the CCAC forward in terms of continuing to meet the needs of Ontarians. At the same time, however, there are, and also I cannot go on without mentioning the Aging at Home initiative, because the Aging at Home initiative, which is going to bring in slightly over $1 billion of new money into the province for support the community care sector, that initiative is attracting attention all over the country, because one of the things you see in the research is that there's an assumption that there's an appropriate supply of services available in the community, and that the issue is managing the supply. Well, in fact, we have not had an adequate supply of a number of community services, such as Meals on Wheels programs, day programs, supportive housing programs, those kinds of things. The Aging at Home initiative brings new money in to help build up that supply. At the same time, it offers opportunities for improvements in hospital care and long-term care access mechanisms to try to support people to stay at home. So those are two big, important things that we're doing in Ontario. However, there are a couple of ongoing issues. One is we have a very poor we do not have an integrated information systems. That's key. Providers across a variety of settings have to be able to share information and know what's going on with a client, and that is not the case. We need to do more there. We do not have a single entry point in Ontario for community care services. It's quite diverse how people access services. With the result, there's a lot of confusion, there's a lack of knowledge, and people can be accessing services in a very uncoordinated way. And that's something that you don't see in Europe. In Europe, they know where to go to get help. In Quebec, they know where to go to get help, because the approaches have been a little bit different, and they may very well know better in some other provinces, but in Ontario we have a mixture of entry points through the community support system, through the CCACs, through the hospitals, through the doctor's offices. There's a lot of different portals, which is not necessarily a bad thing, but you kind of want people to end up in the same place in terms of their access to a professional assessment and care plan. The LHINs offer a wonderful opportunity at the regional level to bring together these different parts of the service sector in ways that will improve the shared information systems in ways that improve coordination of referrals from one agency to another, and the coordinated actual service delivery. And especially through the Aging at Home dollars, most of the LHINs have required the applicants who are applying for those dollars show that how they are coordinating service delivery across an appropriate set of providers for that particular service. And so I think Ontario is going to have some pretty amazing examples of some very nice changes in 2 or 3 years. It takes a while to get new programs underway, understood, get the bugs worked out. It's like doing anything brand new. It takes time, and we have to be a little bit patient. I think Ontario, as I said before, is taking some very nice steps. There is one area that I think we still have not dealt with really, is that in Ontario, in our community support system, there's the issue of fees. There are no fees charged under the CCAC system. all the services are free. That's not necessarily true in other provinces, but in the basket of services that CCACs can administer, those services are free. And in that regard, it's like going to the doctor, going to the hospital. So that's appropriate. The community support agencies that offer services like meals programs, supportive housing, day programs, friendly visiting, lots of transportation, can set fees, and they set them agency by agency. That can provide a barrier to lower income people accessing those services, and as well it contributes to a sense of noise and confusion in the system, because you can have 3 different day programs in the same community and they all offer a slightly different day program and charge different fees, and it's very difficult for families to and sometimes other providers to really understand why one day program is charging $15 a day and the other one's charging $45 a day. There may be very substantial reasons for that, but it's not a transparent fee approach is, I guess, a way to put it. And that's an area that I think could use some work.